Keeping a horse healthy, well, it can feel like a full-time commitment, can't it?
It really can.
And while we focus so much on, feed and daily care, there's this foundational layer. And it often involves more complexity than we might first think. Today, we're taking a deep dive into that. Specifically, equine vaccination.
Mm-hmm.
For this, we've pulled from some really comprehensive guides on vaccination protocols. Think the authoritative word from leading associations, expert vet resources. Really solid stuff.
Right. And our mission today really is to cut through any maybe confusion out there and give you a clear, detailed understanding. Why do we vaccinate? What vaccines are out there? And how is it done? We'll focus on the most important nuggets, the things you really need to know to make good decisions for your horse.
Okay, so if keeping a horse healthy is this huge undertaking, how do we build that solid foundation? I mean, it really comes down to being proactive, right? Preventative healthcare.
Exactly. And vaccinations are, well, absolutely essential to
They're
them.
indispensable.
Yeah. The core idea behind vaccination is basically to stimulate your horse's own immune system, to kind of wake it up, empower it to build strong immunity against specific diseases.
Mm-hmm.
This proactive approach, it's fundamental.
Mm.
It safeguards them from getting seriously ill or developing debilitating conditions, sometimes even fatal ones.
But it's so important to remember, isn't it, that vaccines aren't some kind of magic bullet.
Oh, definitely not. No.
They have to be part of the bigger picture, integrated with other good management practices.
Absolutely. We're talking, proper nutrition, making sure your deworming is effective, good pasture management,
Right.
and things like minimizing stress, avoiding overcrowding in the herd. It all works together.
When all those pieces click, that's when you get the best health outcomes.
And it's not just about protecting one horse either. Think bigger picture. When lots of horses in an area are vaccinated, it seriously reduces the overall spread of disease to the population. It's like a community health benefit.
Herd immunity, essentially.
Precisely.
And timing, that seems critical too. You mentioned being proactive.
Yes, timing is key. Vaccinations need to be given well before any potential exposure. Gives the immune system enough time to actually build up that protective response.
But you can't just vaccinate when there's an outbreak next door and expect it to work instantly.
Exactly. You have to anticipate the risk.
Okay, so who sets the standards for all this? Where do these recommendations come from?
Well, the main authority in the U.S. is the American Association of Equine Practitioners, the AAEP. They're the leading group for horse vets. They provide these really thorough guidelines on vaccines, and they're developed very carefully, looking at things like disease risk, how common a disease is in certain areas, geographic location, and of course, the specific situation of each horse.
And that brings us to a really fundamental point, I think. There isn't just one single vaccination program that works for every single horse out there, is there?
No, absolutely not. That's a crucial takeaway. No one-size-fits-all approach here. Every horse is unique. Different needs, different lifestyles, different environments. So you need a customized plan tailored specifically to that horse.
So what kinds of things does a vet look at when they're tailoring that plan?
Well, several key factors. The horse's age is a big one. Where it lives, geographic location matters a lot. Also, its job, its intended use or activity level. Is it a trail horse? A top competitor? A broodmare? That changes the risk.
Pregnancy status, obviously, for mares.
Right. And just its overall risk profile for catching specific diseases based on all those things.
And it's not like you set this plan once and forget it.
Right.
It has to adapt.
Exactly. The dynamic thing, an ongoing risk management strategy, really.
Yeah.
Think about it. If a horse moves to a new barn or starts traveling more for shows, its exposure risk changes.
Or even just changes in its health status.
Right. That can impact how its immune system responds. So you need that continuous vigilance, always talking with your vet, adapting the plan as needed.
So the AAEP has this framework you mentioned. How does that work?
Yeah, they basically break vaccines down into two main groups. You've got your core vaccines. These are considered essential for pretty much all horses. And then you have risk-based vaccines. These are the ones recommended based on, well, specific exposure risks that a particular horse might face. And importantly, these guidelines try to align with what the vaccine manufacturers recommend for safety and effectiveness whenever they can.
Okay, let's unpack those core vaccines first. Why are these the ones every horse needs, no matter where they live or what they do?
Good question. It's because the diseases they protect against are, well, firstly, widespread. The threat is pretty much everywhere. These diseases are often endemic, meaning they're constantly present in the environment, maybe carried in the soil, by insects, or local wildlife.
So unavoidable exposure,
To
almost.
some extent, yes.
Yeah.
And critically, these diseases often have very high mortality rates. Or there might not be good treatment options once a horse actually gets sick.
And these core vaccines themselves, they're reliable.
Yes, they have a really proven track record. Excellent efficacy and safety profiles over years of use.
Okay, so let's get specific. Which diseases are we talking about for core protection?
All right, first up is Eastern and Western equine encephalomyelitis. We usually call it EE and WE. These are nasty viral diseases. They attack the central nervous system, and they are often fatal. Particularly EE mortality rates can be 70 to 90%, really high.
Wow. And how do horses get it?
It's transmitted only by infected mosquitoes. So insect control is part of prevention too, but the vaccine is key. Symptoms come on pretty fast after a bite, maybe 5 to 10 days. Starts with listlessness, fever, then progresses quickly to severe neurological signs, incoordination, muscle twitching, maybe head pressing, seizures.
Scaredy stuff. Is there one vaccine for both?
Yes, thankfully. There's a single bivalent vaccine that protects against both E and WE. Typically, it's given once a year in the spring before mosquito season really ramps up.
But maybe more often in some places.
Exactly. In warmer climates like Florida, for example, where mosquitoes are a year-round problem, a semi-annual booster, so every 6 months, might be recommended.
Okay, EWE. What's next on the core list?
Next is tetanus. This is another really serious one, often fatal neurological disease. It's caused by a neurotoxin from bacteria, Clostridium tetani, and this bacteria is literally everywhere. It's in the soil all over the world and even commonly found in a horse's own gut.
So you can't escape the risk just by keeping the barn clean?
Not at all. Horses are highly susceptible. Infection usually happens through wounds, punctures, cuts, even really minor scrapes can be an entry point, or complications after foaling or surgery.
And what does tetanus look like in a horse?
It causes these very characteristic rigid neurological signs. The classic sawhorse stance, where they're stiff like a wooden horse, lockjaw, where they can't open their mouth, muscle spasms. It's agonizing, and often euthanasia is the kindest option. And here's the really crucial part. Because those bacteria are everywhere in the soil, there is simply no such thing as a low-risk environment for tetanus for your horse.
So vaccination is non-negotiable, basically?
Absolutely essential. Standard practice is annual revaccination. Plus, if a horse gets a deep puncture wound or needs surgery, and its last tetanus shot was more than 6 months ago, a booster is usually given right away.
Makes sense. All right, what else is core?
Then we have rabies. Everyone's heard of rabies.
Wow.
It's an invariably fatal neurological disease. Affects all mammals, horses included. And it's a huge public health concern, too, because it's zoonotic, it can pass from animals to humans, and it's 100% fatal once clinical signs appear, both in horses and in people.
How do horses typically get rabies?
Primarily through bite wounds from infected wild animals. Raccoons, skunks, foxes, bats are the common culprits. Symptoms can vary. Sometimes it's the furious form, agitation, aggression, paralysis. Other times it's the paralytic or dumb form, depression, maybe excessive salivation, stumbling, ataxia, then paralysis. Diagnosis, sadly, is usually post-mortem by examining brain tissue.
So given how severe it is and the risk to humans,
Vaccination is incredibly effective. It offers basically 100% preventability if done correctly. So it's vital for protecting both the horse and the people around it. Annual vaccination is universally recommended for every horse, period.
okay, one more core vaccine, I think.
Yes. The last one is West Nile virus, or WNV. It's another mosquito-borne virus. It can cause neurological disease in horses, and it really spread across the U.S. starting back in 1999. It's pretty widespread now.
Where does it come from? How do mosquitoes get it?
It's maintained mainly in wild bird populations. Mosquitoes bite infected birds, then bite horses, transmitting the virus. Horses, and humans actually, are considered dead-end hosts. They can get sick, but they don't typically spread it further.
What are the symptoms if a horse gets WNV?
It can cause inflammation of the brain and spinal cord encephalitis, or encephalomyelitis. So you might see fever, neurological signs like stumbling, incoordination, muscle tremors, weakness, sometimes partial paralysis. And unfortunately, about half, roughly 50% of the horses that show clinical signs end up succumbing to the disease.
So another serious threat, vaccination strategy.
An annual booster is recommended, again, usually in the spring before mosquito season. But here's an interesting point showing how things get tailored. In areas where WNV is really common, really endemic, like maybe parts of California or the Southeast, Vets might recommend semi-annual boosters or sometimes even more frequent ones, maybe every 4 months in very high-risk situations.
Yeah.
It shows how even a universally needed vaccine might require more intense schedules depending on local conditions.
That makes sense. It really highlights the need for that vet consultation. Okay, so those are the core four: EWI, tetanus, rabies, and West Nile. Essential for everyone.
Correct.
Now, beyond those, you mentioned this whole other category, risk-based vaccines, the ones that depend more on the individual horse's situation.
Exactly. These aren't universally recommended for every horse like the core vaccines are. Instead, the decision comes down to a careful assessment. Does this particular horse have factors that elevate its risk of exposure to certain other diseases?
What are those key factors you consider?
Well, several things come into play. First, geographic location is huge. The prevalence of certain diseases varies a lot by region. You'll see more need for vaccines against certain mosquito-borne diseases, for example, in the southeastern U.S.
And that can change, right, with climate patterns shifting?
Absolutely. Climate change can shift where insects live or how long their active season is, potentially bringing diseases into new areas. So, location risk isn't static. Second is lifestyle and activity level. A horse that travels a lot for shows, competitions, or even just frequent trail rides in new places, well, it's going to encounter a much wider range of potential pathogens.
And other horses, maybe with unknown vaccination histories.
Exactly. Compare that to a horse that pretty much stays home its whole life.
Yeah.
The exposure risk is fundamentally different. Third, we look at the barn population and companions. Even if your horse is a homebody, what about the other horses in the barn? Is there high turnover, with horses coming and going frequently?
Bringing potential germs with them.
Right. Or do barn mates travel? What about neighboring properties? Pathogens can sometimes be carried by insects between properties or even through the air for some respiratory diseases.
So that really challenges the idea that you can just create a simple biosecurity bubble around your one horse, doesn't it?
It really does. It shows how interconnected horse health is, even within a local community or boarding facility. Your horse's risk depends partly on the risks of the horses around it.
That's a fascinating point. So for an owner who might think their horse is low risk because it just stays on their property, what are some of those less obvious ways disease could still be a threat? Things that might make them rethink and call the vet?
Yeah, that's a great question because risk isn't always obvious. Like you said, maybe your horse stays home, but what if a new horse moves into the stall next door? Even if it looks healthy, it could be shedding something, or, like we discussed with West Nile, maybe insects carrying diseases are just prevalent in your geographic area, regardless of horse movement. Wind can carry things, contaminated water sources nearby, shared equipment that isn't properly disinfected.
Okay, so it's complex.
It really underscores why that conversation with your vet is so crucial. They can help identify those less obvious risks. And think about how risks can layer up or compound. Imagine, say, a young performance horse. Maybe its immune system isn't fully mature, it lives in an area endemic for a certain disease, and it's housed in a busy boarding barn with lots of travel. That horse is facing multiple layers of risk factors.
That makes total sense. It paints a clearer picture of why personalization is so key.
And the last factor is age, health status, and occupation. Young foals and very old horses often have different immune responses, maybe less robust.
Makes sense.
A horse that's ill or under significant stress, maybe from intense training or transport, might not respond optimally to a vaccine. And then specific jobs have unique needs. Breeding animals, performance horses, they have different considerations.
All right, let's dive into some of the common risk-based vaccines then. Which ones come up frequently?
Okay, a big one is equine herpes virus. You'll often hear it called EHV1 and EHV4, or sometimes just rhinopneumonitis, or rhino. This virus is highly prevalent in the horse population. It can cause several problems. Respiratory illness, kind of like the flu. Neurological disorders, there's a specific, potentially fatal neurological form called EHM, equine herpes virus, myeloencephalopathy.
That sounds serious.
It is. And EHV1 is also a major cause of abortions in pregnant mares.
So who needs this vaccine most?
It's really crucial for horses that travel, compete, or live in high-density environments like boarding stables or training centers where exposure is more likely. Vaccination frequency varies quite a bit based on the horse's risk. It could be anywhere from every 3 or 4 months for some high-risk performance horses up to maybe just annually for lower-risk ones. Many vets recommend every 6 months for horses with significant exposure risk.
And what about those pregnant mares you mentioned?
Ah, yes. For pregnant mares, there's a very specific protocol using an inactivated EHV1 vaccine. It's typically a 3-dose series given during the 5th, 7th, and 9th months of gestation. This is critical to help prevent EHV1-related abortions. Some vets might add an earlier dose, maybe around the third month, and often a pre-foaling booster to maximize antibodies in the colostrum for the foal.
So the vaccine prevents abortion. Does it also prevent that neurological form, EHM?
That's a really important clarification. No, currently available vaccines do not reliably prevent the neurological form, EHM. Their main purpose regarding EHV is to reduce the severity of respiratory disease, limit shedding of the virus, and with the specific protocol in mares, help prevent abortion. It's about disease mitigation and reducing transmission, not necessarily full prevention of all forms.
Got it. Okay, what's another common risk-based one?
Equine influenza, or flu. Just like human flu, it's a highly contagious viral respiratory disease.
Yeah.
You see fever, coughing, nasal discharge, lethargy. It can spread like wildfire through a barn, especially among horses that have contact with others, like at shows or sales.
Is the vaccine immunity strong?
Well, that's the tricky part with flu. Vaccine immunity tends to be relatively short-lived, maybe only a few months, and it's often incomplete, meaning a vaccinated horse might still get sick, but hopefully less severely.
So frequent vaccination might be needed.
Exactly. Again, it depends on risk. High-risk horses, like race horses or show horses in constant contact with others, might get boosters every 3 to 4 or maybe 6 months. Low-risk horses might just get it annually.
Okay. What about strangles? That sounds unpleasant.
It is. Strangles is caused by a bacteria, Streptococcus equine. It's another highly contagious infection, causes respiratory issues, fever, nasal discharge. But the hallmark is these painful, swollen lymph nodes, usually under the jaw. They can actually abscess and burst, releasing infectious pus.
Yikes. And that discharge spreads it easily.
Very easily. Contaminated feed buckets, water troughs, tack, handlers' hands. It spreads readily. So it's often recommended for horses at higher risk, those in busy boarding barns, horses going to show ground, sales, that kind of thing.
Are there different types of strangles vaccines?
Yes, there are two main types. There's an intramuscular vaccine, which uses killed bacteria, and there's an intranasal vaccine, which is given up the nose and uses a modified live, weakened form of the bacteria.
Any special considerations with those?
Yes, a really important precaution with the intranasal one. Because it's a live vaccine, you have to be extremely careful not to contaminate other injection sites. It should never be given at the same time as other injectable vaccines using the same needle or even potentially contaminating the area.
Why not?
If that live intranasal vaccine bacteria accidentally gets injected into muscle, it can cause nasty abscesses at the injection site. So meticulous handling and administration are key. Often vets will give the intranasal vaccine last after all other injections are done.
Good to know. Frequency for strangles.
For high-risk horses, often semi-annually, so every 6 months.
Okay, moving on. What about Potomac horse fever, PHF?
Potomac horse fever, or PHF, this is a bacterial disease, Neorickettsia rustitiae, causes fever, often colic, and can cause severe diarrhea or laminitis. It's got an interesting transmission cycle. It's associated with rivers, ponds, wetlands, aquatic environments.
How do horses get it from water?
They don't get it directly from the water, usually. The bacteria infects flukes, which then infect aquatic insects like mayflies or caddisflies. Horses accidentally ingest these infected insects, maybe while grazing near water, or if the insects are attracted to barn lights and fall into feed or water buckets.
Fascinating. Is it everywhere?
No, it's much more common in specific endemic areas. Traditionally, near the Potomac River, hence the name, but also found in the Great Lakes region, other parts of the eastern U.S., near St. Louis, even parts of California. So vaccination is mainly recommended for horses living in or traveling to those known endemic areas.
How often?
Typically, after the initial primary series, it's an annual booster. But in really highly endemic areas, vets might recommend semi-annual vaccination. It's worth noting the vaccine has had a history of, some reported failures. It doesn't always provide complete protection against infection. However, many vets in endemic areas feel it significantly reduces the severity of the disease if a horse does get infected.
So still potentially worthwhile in those areas?
Yes, that's the consensus.
All right. What about botulism?
Botulism, another serious neurological disease, often fatal, caused by toxins produced by Clostridium botulinum bacteria. It causes progressive muscle weakness, leading to paralysis. Horses might have trouble swallowing, walking, even breathing.
Who's most at risk?
Foals are particularly susceptible, especially to a form called shaker foal syndrome. Also, adult horses that might ingest the toxin through contaminated feed particularly things like improperly fermented haylage or silage, sometimes round bales where a dead animal might have been incorporated.
Is there a vaccine?
Yes, there's a vaccine available, but, and this is important, it primarily protects against only one type, serotype B, which is the most common cause in some regions like Kentucky and the Mid-Atlantic.
So it doesn't cover all types of botulism.
Correct, it protects only against type B. Horses can still be susceptible to other, less common serotypes like A or C. The vaccine protocol is usually an initial 3-dose series, followed by annual boosters, especially recommended for mares in endemic areas to protect their foals via colostrum, and for any horse being fed potentially risky forage like haylage.
Okay. Are there any other risk-based vaccines we should quickly touch on?
Yeah, just briefly, there's equine viral arteritis, or EVA. This is mainly a concern for the breeding industry. Vaccination is typically recommended for breeding stallions, and sometimes mares before they are bred. Pregnant mares generally should not be vaccinated. There's rotaviral diarrhea. The vaccine is given to pregnant mares to boost antibodies in their colostrum, which then helps protect their foals against severe diarrhea caused by rotavirus. In some regions, a snakebite vaccine might be considered, particularly for protection against rattlesnake venom, though its effectiveness can be debated. And then there are vaccines for things like anthrax, leptospirosis, and Venezuelan equine encephalomyelitis, VEE. VE is distinct from EWE and is usually only vaccinated against if there's a specific outbreak or threat, often mandated by authorities. Leptospirosis vaccines are newer and used in areas where that bacterial disease is a concern. Anthrax is rare but serious, so vaccination might occur in specific endemic locales.
Wow, okay. That's a lot of potential vaccines beyond the core ones. Really drives home the need for that individual risk assessment with your vet.
Absolutely.
So now that we know about the different types of vaccines, how do they actually fit into a schedule? You mentioned starting foals around 4 or 6 months.
Right. Generally, the primary vaccination series starts in the first year of life. We wait until about 4 to 6 months, because before that, the foal usually has maternal antibodies they received from the mare's colostrum, that first milk.
And those antibodies can interfere with the vaccine.
Exactly. Those maternal antibodies can actually block the foal's immune system from responding properly to the vaccine. So we wait until those antibodies naturally start to wane.
And that primary series, you said it's usually 2 or 3 doses.
Typically, yes. For most killed vaccines, it's an initial dose, followed by a second dose 3 to 6 weeks later, and sometimes a third dose a month or so after that, depending on the specific vaccine and the foal's situation. This series is crucial. It acts like a primer for the immune system. It teaches it how to recognize the pathogen so it can mount a strong, lasting response later on.
And skipping doses is a bad idea.
A very bad idea. You really compromise that long-term protection if you don't complete the full primary series as recommended. The immune system just won't build that robust memory.
How long after the series is the horse protected?
Generally, you expect good protective immunity to develop within about 1 to 2 weeks after completing the entire primary series.
Okay. And then for adult horses, it's mostly about boosters.
Right. For most vaccines, after that initial series, annual boosters are needed to maintain those protective antibody levels. Think of it like a reminder for the immune system.
And spring is often the ideal time.
Yes, especially for diseases spread by insects like West Nile and iwi. Giving the booster in the spring, maybe March or April depending on your climate, ensures the horse has peak immunity right before the insect season really gets going.
But some might need boosting more often. You mentioned WNV in certain areas, maybe needing a fall booster too.
Correct. In areas with very long mosquito seasons or high disease pressure, an additional booster in the fall might be recommended for WNV, or even more frequent boosters for iwi or flu in high-risk performance horses.
Can we briefly touch on typical schedules for different life stages, like foals versus adults versus pregnant mares?
Sure, it gets detailed, but generally, for foals and young horses, that initial immunity from colostrum is key. They must nurse effectively within the first 12 hours or so. Then vaccinations start around 4 to 6 months. The exact schedule for core vaccines like iwi, tetanus, WNV, and rabies will vary slightly based on the mare's vaccination status and the specific vaccine product used. Risk-based vaccines like rhino-flu or strangles might also start in this period if the risk warrants it. Botulism, if needed, often starts even earlier, maybe 2 to 3 months, with its 3-dose series.
Okay. And for regular adult horses?
Most adults who had their primary series as youngsters will just need annual boosters, typically in the spring for the core vaccines. Tetanus, rabies annual, iwi annual, maybe every 6 months in endemic areas, WNV annual, but again, potentially semi-annual, or even every 4 months in very high-risk endemic zones. For the risk-based ones in adults, rhino flu could be anywhere from every 3 to 4 months to annually, depending on risk. strangles, often semi-annual if high risk, ptomac horse fever, annual or semi-annual in endemic areas.
And high-risk adults, like the traveling show horses.
Yes, those horses often benefit from more frequent boosters, typically every 6 months, for things like EHV, rhino, and influenza, due to their constant potential exposure.
Finally, pregnant mares and breeding stock. Their schedule seems particularly important.
It's critical both for their own health and especially for providing that passive immunity to the foal through colostrum. So mares should be up to date on core vaccines before being bred if possible. Rabies should definitely be given pre-breeding. During pregnancy, they'll get their routine annual boosters for tetanus, EW, WNV, usually about 4 to 6 weeks before their due date. This maximizes antibodies in the colostrum.
And that special EHV1 series.
Yes, that crucial 3-dose series at months 5, 7, and 9 of gestation to help prevent abortion. And often another booster just before foaling. If botulism is a risk, the mare gets her booster prepartum. If rotavirus is a concern, she gets that 3-dose series starting around 8 months of gestation. Breeding stallions also have specific needs, often getting vaccinated for EHV before the breeding season starts.
That's definitely a lot to keep track of. It really shows why having those detailed records and vet guidance is essential.
Absolutely. And while a comprehensive table, like you might find in vet resources, can be a handy, quick reference, it never replaces that personalized discussion with your veterinarian.
Okay, so we've covered the why, the what, and the when. Let's talk about the how. Best practices for actually administering these vaccines. It's more than just picking the right vial, isn't it?
Oh, much more. Effective vaccination goes way beyond just vaccine choice. It includes really meticulous administration, and it should be part of a whole health program. Ideally, too, all horses living together should be on a similar, appropriate vaccination schedule.
What are some general things to keep in mind right before giving a shot?
Well, first, you want to make sure the horse is actually healthy. Taking their temperature is a good start. It should be normal.
Why is that so important?
Vaccinating a horse that's already sick, maybe running a fever, or is highly stressed, well, their immune system might not respond properly to the vaccine. They might not build good immunity, or they could even have an increased chance of an adverse reaction.
And it takes time for the vaccine to work anyway.
Right. Protection isn't instant. It takes days, often weeks, for the immune system to fully respond after vaccination. So timing relative to health status matters.
You also mentioned a safety tip earlier, untie the horse.
Yes, that's a good practical tip. Just before the injection, it's generally safer to untie the horse or have someone hold them securely but allow for some movement. If the horse startles or reacts to the needle, being tied rigidly could potentially cause injury.
Makes sense. What about handling the vaccines themselves? Storage seems critical.
It's absolutely critical. Most vaccines contain sensitive biological components, killed viruses, modified live viruses, proteins. They need careful handling. New vaccines should usually be unpacked within an hour of arrival and stored immediately at the correct temperature, which is typically refrigerated, between 35–45 degrees Fahrenheit or 2 to 7 degrees Celsius. Don't freeze them unless specifically instructed.
How about taking them out to the barn?
They need to be transported in a cooler with cold packs, and they shouldn't be taken out of that cold storage until you're literally ready to draw them up and administer them. If the cold packs have melted or if a vaccine is expired, it should be discarded. Don't use it.
What about vaccines that need mixing, reconstitution?
Right, some come in 2 parts, a powder and a liquid diluent. You only use the specific diluent provided by the manufacturer for that vaccine. Never mix different vaccine products together in the same syringe unless they are explicitly designed for that. And once you mix it or reconstitute it, you typically need to use it pretty quickly, often within 60 minutes because it may not be stable for long. Follow the label directions precisely.
Okay, now the injection itself. Where do you give the shot? Site selection seems really important for safety, both the horses and the handlers.
Paramount. Absolutely paramount for both. You need to minimize the risk of injury to the horse, like hitting a nerve or blood vessel or causing excessive soreness. And you absolutely need to minimize the risk of injury to the person giving the injection.
Which means the horse needs to be reasonably cooperative.
Yes. Proper training, desensitizing the horse to the procedure, having good handling, these aren't just conveniences, they are essential safety measures.
So where are the recommended spots?
The most common and generally safest area is the lateral neck. There's a specific triangular-shaped muscle mass there, well away from the spine and major ligaments. It's easy to access safely on most horses. Another good option, especially if the neck muscles get sore or for multiple injections, is the hamstrings, specifically the large semitendinosus muscle on the back of the hind leg. It's a big muscle, trains well if there's swelling, and it's often preferred for foals. The pectoral muscles, the chest muscles, are large too, but giving an injection there can sometimes put the handler in a more vulnerable position if the horse reacts suddenly, and soreness there can sometimes make the horse reluctant to move its front legs.
What about the hip, the gluteal muscles? I feel like I used to see that done more often.
Yes, that used to be more common, but it's generally not recommended anymore. The gluteal muscle-ship area, while large, has relatively poor drainage. If an abscess were to form there after an injection, it can be very difficult to treat and can lead to prolonged healing and complications. So most vets avoid the hip now. It definitely challenges some older practices.
Good to know. Any other areas to strictly avoid?
Definitely avoid the jugular groove area in the neck. That's where the major blood vessels run. And as we mentioned for fold, avoid the neck muscles if possible, because soreness there could make them reluctant to lower their head to nurse. The hamstrings are often better for them.
Okay, so you've picked the spot. What about the actual injection technique? Needle size, sterility.
Precision and sterility are key. Your vet will choose the right needle size. For most intramuscular injections in adult horses, it's usually a 20 or maybe 22 gauge needle, typically 1.5 inches long to ensure it gets deep into the muscle. Sometimes an 18 gauge for thicker solutions, maybe a 1-inch needle for smaller horses or foals. Sterility is non-negotiable. You must use a brand new sterile needle for every single injection. And a new needle for each horse, of course. Never reuse needles between horses.
How do you actually insert the needle?
First, you disinfect the skin surface, usually with an alcohol swab. Let it dry briefly. Then, insert the needle perpendicular to the skin, straight in, all the way to the hub, the plastic part where it attaches to the syringe. It should be a quick, firm, deliberate motion, like throwing a dart, not a slow push.
Then you attach the syringe and inject.
Not quite yet. Before injecting, there's a critical safety step: aspiration.
What's that?
And if the needle is in the muscle, you pull back slightly on the syringe plunger. You're checking to make sure you haven't accidentally entered a blood vessel.
What happens if you see blood come into the syringe?
If blood appears when you aspirate, you must not inject. You need to withdraw the needle, discard it ideally, get a fresh, sterile needle, and choose a slightly different spot nearby to reinsert and aspirate again.
Why is that so critical?
Accidentally injecting a vaccine intravenously into a vein when it's meant for intramuscular use can cause a severe, potentially fatal anaphylactic reaction. Aspiration is a vital safety check.
Wow. Okay, so aspirate, no blood, then inject.
Correct. Once you're sure you're clear, you inject the vaccine slowly and steadily.
Is there a limit to how much you inject in one spot?
Yes. To ensure good absorption and minimize local reactions, there's generally a maximum volume per site, usually around 10 milliliters. ml.
Yeah.
If the total dose is larger than that, you need to split it between multiple injection sites.
And after the injection?
Withdraw the needle straight out. Sometimes gently massaging the site for 20-30 seconds can help disperse the vaccine and maybe reduce soreness a little. Dispose of the needle and syringe safely in a sharps container.
That is definitely a lot more involved than just a quick jab. It really highlights that proper technique is crucial for safety and effectiveness.
Absolutely. Every step matters.
So speaking of what happens after the shot, let's talk about vaccine reactions. We know they can happen. What should a horse owner typically expect? And more importantly, when should they start to worry and call the vet?
Right. It's really important to differentiate between what's a normal expected response from the immune system gearing up versus a more serious adverse reaction. It's quite common and generally acceptable to see some mild temporary signs after vaccination. Things like some local muscle soreness or stiffness at the injection site, maybe slight swelling there, a low-grade fever for a day or so, maybe the horse is a little quieter, slightly reduced appetite, a bit lethargic.
And these usually go away on their own?
Yes. Typically, these are self-limiting. They resolve within 24-48 hours usually, without any specific treatment needed. It just shows the immune system is responding.
Okay. But sometimes things can be more severe.
Yes, unfortunately. More severe reactions can occur. These can be local reactions, like really marked pain, heat, or excessive swelling at the injection site that doesn't go away quickly. Or they can be systemic reactions affecting the whole body. This could range from more persistent or higher fever, significant loss of appetite, anorexia, or profound lethargy. More seriously, you can see allergic-type reactions. These might manifest as hives, raised welts on the skin, or a condition called purpura hemorrhagica, which is a severe immune reaction affecting blood vessels, or even signs like colic.
And the most critical reaction?
The most critical is anaphylaxis. This is a sudden, severe, life-threatening allergic reaction. It can cause a rapid drop in blood pressure, difficulty breathing, sometimes severe diarrhea or colic. It's an absolute emergency.
Okay, that sounds terrifying. So when does an owner need to pick up the phone and call the vet immediately? What are the red flags?
Definitely call your veterinarian right away if you see a fever that persists for more than a day or two, or is particularly high, widespread itching or hives covering the body, any swelling of the skin, especially around the face or muzzle,
What else?
vomiting, which is rare but very serious in horses, diarrhea, especially if severe or watery, any signs of difficulty breathing, wheezing, or respiratory distress, if the horse just seems generally sick, really depressed, or unwilling to move. Also, if there's pronounced heat, swelling, or pain at the injection site that seems excessive or lasts more than a couple of days, or if the horse develops significant stiffness or difficulty walking, obvious loss of appetite, signs of colic. Basically, anything beyond those mild transient signs we talked about warrants a call.
Better safe than sorry.
Absolutely. Prompt veterinary attention is essential for managing more severe reactions.
How are these reactions typically treated?
For more pronounced local soreness or swelling, your vet might recommend things like nonsteroidal anti-inflammatory drugs, NSAIDs like phenylbutazone or flunixin, sometimes cold hosing initially, then maybe warm compresses. Systemic reactions like hives or fever might also be treated with NSAIDs or sometimes corticosteroids. But anaphylaxis that requires immediate, aggressive emergency treatment, usually with epinephrine, IV fluids, corticosteroids, antihistamines, it's life or death.
Now, here's something interesting. If a horse reacts badly once, is it likely to happen again?
That's a crucial point, yes.
Yes.
If a horse has had a significant adverse reaction to a particular vaccine or type of vaccine, there's a higher risk that the next reaction could be even more serious. The immune system essentially remembers that adverse response.
So what can be done to try and prevent that if a horse needs vaccinating but has reacted before?
There are several strategies your vet might consider. They might try switching to a different type or brand of vaccine for that disease, if available. Perhaps one made differently, like killed versus modified live, or one with different adjuvants the substance is added to boost the immune response, which can sometimes trigger reactions. Pre-treatment with an anti-inflammatory, like flunixin, shortly before a vaccination, might help blunt the reaction in some cases. If the reaction was potentially linked to a multi-component vaccine, like a 5-way, they might opt to separate those into individual injections given at different times or locations.
What about the intranasal vaccines?
Administering intranasal vaccines very carefully, ensuring none drips out and contaminates injection sites is important. And generally, avoiding vaccination when a horse is already immunocompromised or stressed is wise, unless the risk of the disease is so high that the benefits clearly outweigh the potential risks of a poor response or reaction. It's a balancing act.
And finally, reporting these reactions. You mentioned that earlier. Why is that so important? Who do you report it to?
Yes, it's crucial. Any suspected adverse vaccine reaction should be reported, both to the vaccine manufacturer and to the USDA Center for Veterinary Biologics, which oversees veterinary vaccines. Your veterinarian can help with this reporting process. It's important to have the vaccine details, the product name, the lot number, and the serial number from the vial label.
Why does this reporting matter so much?
Because vaccine safety is an ongoing process. This post-market surveillance collecting data on how vaccines perform in the real world after they're licensed is vital. Owner and veterinarian reporting helps manufacturers and regulatory agencies identify potential problems with specific batches, track the frequency and types of reactions, and ultimately contributes to making vaccines safer for all horses in the future. It's a collaborative effort.
So even though adverse reactions are an inherent, though usually small, risk with any vaccine?
Right. Reporting helps manage and minimize that risk over time.
Okay, this has been incredibly informative. We've covered so much ground. As we start to wrap up, let's circle back to the role of the veterinarian. It seems absolutely central to everything we've discussed.
It really is. I can't stress this enough. Developing an effective, safe, and appropriate vaccination program absolutely hinges on working closely with a qualified equine veterinarian. They bring the specialized expertise. They can interpret all those complex risk factors we talked about, the geography, the lifestyle, the individual horse's health. They stay up to date on the latest research, emerging diseases, and changing recommendations.
They're like the risk navigator you mentioned earlier.
Exactly. Relying solely on general guidelines you find online or in a book, it's just not enough. You need that expert partner to tailor the plan specifically for your horse in your situation.
And alongside that collaboration, the importance of good records. We touched on it, but let's reinforce that.
Yes, meticulous record keeping is vital. You need accurate and comprehensive vaccination records for each horse.
What specifically should be recorded?
Dates of vaccination, obviously. The specific vaccines, given product name, manufacturer. Critically, the vaccine lot and serial numbers, especially if there's ever a reaction. And, of course, documenting any adverse reactions that did occur.
Why are these records so crucial? What are they used for?
They serve multiple purposes. They create a longitudinal health history for the horse, tracking its immune protection over time. They document any known sensitivities or reactions. They're often required for transport, especially across state lines or internationally. They are needed to meet entry requirements for competitions, shows, or clinics. New boarding facilities will almost always require proof of vaccination.
So it's kind of like a biosecurity passport for the horse?
That's a great way to put it, yes. It's crucial for the individual horse's health management, for protecting the health of other horses it comes into contact with, and for meeting regulatory or facility requirements. It's just good practice.
Okay, so to really bring this all together, vaccinations, undeniably a vital part of preventive equine care, right? A real cornerstone of keeping your horse healthy.
Absolutely, a cornerstone. And having that well-crafted, personalized vaccination program designed with your vet, adhered to consistently, is just crucial for building a strong immune system and supporting the overall vitality of your horse.
And remembering it's not static. It needs regular check-ins.
Periodic reviews, yes. As the horse's life changes its age, its job, where it lives, where it travels, the vaccination plan might need adjustments. That ongoing conversation with your vet is key. And finally, always remember, vaccination is powerful, but it's not a panacea. It works best as part of a comprehensive approach. Good nutrition, diligent deworming, smart biosecurity practices like quarantining new horses. They all work together with vaccines for the best protection. Ultimately, making proactive, informed decisions collaboratively with your veterinarian, that's the most effective way to safeguard the lifelong health and well-being of your horse.
That's a perfect summary. Proactive, informed, and collaborative. It leads me to a final thought for our listeners to maybe mull over. Considering just how much effort, how much individual tailoring goes into creating the right vaccine plan for just one horse, what does that tell us about maybe the limitations of a one-size-fits-all approach to health, not just for horses, but perhaps in other areas of life too?